So first is the olfactory nerve. So to test the olfactory nerve, ask your patient to sit in a comfortable position and at your eye level, and then ask the patient to clear his nose to remove any mucus, and then let the patient identify the scent of an object that you are hearing. So close your eyes. I will occlude the other nostril, and then
Coffee.
okay, good. So next is the um, optic nerve, or the vision. So first is um, test one is the peripheral vision using the um, confrontational visual field. So I'm gonna ask the patient to stand up, and then an arm length away, and then close your right eye, cover, and then I will cover also my left eye. So the patient should determine how many fingers I am presenting in the peripheral vision in the upper, lower, and middle visual field. So
3, 2, 1.
okay, in the other eye.
3, 2, 1.
Okay, good. So next is test 2 is the visual acuity using a Snellen chart. So I'm gonna ask the patient to stand 20 inches away from the chart, and then I'm gonna ask him to read the uh, little line, or the smallest line he can read. So please cover your right eye, and then read the little you can read.
D, E, F, P, O, T, E, C.
Okay, good. In the other eye.
D, E, F, P, O, T, E, C.
Okay, good. And read with your both eyes.
D, E, F, P, O, T, E, C.
Okay, good. So as I can see that the patient read the smallest line in number 8, and that is 20/20, and that means that his vision is normal. Okay, next. So number 3 is the oculomotor, the trochlear, and the abducens. So the functions of those three is the oculomotor is the innervates the extrinsic eye muscles and ciliary muscles, and the trochlear is innervates the superficial muscles, and the number 3, the abducens, is innervates the external rectus muscle. So first is test 1 is to assess the extraocular movement. So I'm gonna use a pen, and I'm gonna ask the patient to look at the pen and follow where I move this pen in a 6 cardinal gaze. So please look at the pen, and then follow where I move it in the lower right, far right, upper right, lower left, far left, and the upper left. So as we can see that his eyes doesn't shake, so that is normal. So next is to test the pupillary response by by using a pen light, I will ask the patient to stare at a distant object, and then I will use a pen light to shine here at the side of the eyes. So the pupil constricted, and I will do it on the other side. So on the other eye, the pupil constricted as well. And the next is to test for accommodation. So I will ask the patient again to stare at a distant object to help the dilate the pupils, and then I will use a pen and I will place it 12 to 14 inches away from the patient's nose, and then I will move it inwards. So as we can see that his pupils constricted, and when and um, his eyes closed, his eyes crossed when I move this pen inwards. So next is the number 6, the trigeminal. So to test the trigeminal, I will palpate I will ask the patient to clench your teeth, and then I will palpate the masseter muscles and the temporal to see for any contractions. And then next is to ask the patient to open his mouth and then open against my resistance. Again. So good. So next is we're going to proceed to the facial. So I'm gonna ask the patient to close his eyes tightly and then open them up. Open. And then I'm gonna ask the patient to smile, to frown, and then puff out cheeks. Okay, good. So next is we're going to proceed to the acoustic or the vestibulocochlear. What I'm going to do is I will occlude the other side of the ear, and then I will whisper in the other side, and then the patient should hear what I said. Here, closed here. Apple.
Apple.
Okay, good. So he heard what I said. So let's now proceed to the glossopharyngeal and the vagus. So to test that, so test 1, to test the motor function, I'm going to use a tongue depressor. I'm gonna ask the patient to say ah.
Ah.
Okay. And next is to check the gag reflex. I will touch the posterior pharynx, and I will tell him that this test might get him uncomfortable. So this might be an uncomfortable test. So is that okay with you?
Okay, ma'am.
Okay, so open your mouth. Okay, good. And the next is I will check the patient's ability to swallow. So I'm gonna ask the patient to drink water, and then also check the voice quality. So the patient is able to swallow with ease. So next is I'm going to proceed to the spinal accessory. So I'm gonna ask the patient to move his head up and down and then side to side. And then I'm going to shrug his shoulders against my resistant to check for the trapezius. Okay. Okay, good. And lastly is the hypoglossal. The hypoglossal is to check the mobility of the tongue. So I'm gonna ask the patient to open his mouth, stuck out your tongue, and then move it side to side. Okay. So the patient done it with ease. Thank you.